The neuromuscular junction is a highly specialized synapse between a motor neuron nerve terminal and its muscle fiber that are responsible for converting electrical impulses generated by the motor neuron into electrical activity in the muscle fiber. Now, we sometimes need to shut these mechanisms down, say to cause a paralysis in surgery. And at that moment, neuromuscular blockers come in handy and are used as a drug of choice. So the question of the day is, how do neuromuscular blockers work? Well, neuromuscular blockers are the drugs which prevent transmission of nerve from nerve fiber to the muscle fiber through the neuromuscular junctions. These drugs are widely used during surgery and trauma care. Neuromuscular blockers used during anesthesia to relax the skeletal muscles and induce paralysis so that the surgery can be conducted with less complications. Today we will talk about 4 important neuromuscular blockers which are commonly used in clinics and research, and we will see how they perform their function after administration. Well, these are namely Curare, that is derived from Strychnos toxifera, Bungarotoxin, derived from a venomous snake called Bungarus multicinctus, Succinylcholine and Carbamylcholine, that are derived from bisquaternary ammonium compound. They were basically synthesized in a lab. And Botulinum toxin, that is derived from a bacteria known as Clostridium botulinum. So let's talk about them one by one. If we talk about Curare, it prevents the neuromuscular transmission by combining with acetylcholine receptors. So the acetylcholine cannot combine with the receptors, and the end plate potential cannot develop. So Curare blocks the neuromuscular transmission by acting on the acetylcholine receptors, so it is known as a receptor blocker. If we talk about Bungarotoxin, then it is a toxin from the venomous deadly snake, as I told you earlier. It affects the neuromuscular transmission by blocking the acetylcholine receptors. Alpha-neurotoxin antagonistically bind irreversibly to acetylcholine receptors of skeletal muscles, thereby blocking the action of acetylcholine at the post-synaptic membrane, inhibiting all the ion flow and leading to paralysis. So if we talk about the next one, Succinylcholine or Carbamylcholine, both of them have similar mechanism of action. These drugs block the neuromuscular transmission by acting like acetylcholine and keeping the muscle in a depolarized state. But these drugs are not destroyed by cholinesterase, so the muscle remains in a depolarized state for a longer period of time. Last one is botulinum toxin. It is derived from a bacteria known as Clostridium botulinum, which is going to prevent the release of acetylcholine from axon terminal into the neuromuscular junction. So that was all about these 4 drugs. Watch out for our Scanimation week to get your question answered quickly, and stay tuned to sqadia.com.